All right, I'm not guaranteeing I'm going to get through this without crying, so bear with me. My name is Karen Green. This is my daughter, Allison. She's 34 years old. I'm going to share with you how cuts to Medicaid, specifically the Michigan Medicaid waiver program, which is discretionary and could possibly be the first kind of program to go, would affect our family. First, a bit of how we got here. In 1991, my partner and I were raising a young adult daughter with disabilities when we were able to fulfill the dream of completing our family by adopting Allison when she was 7 months old. We knew Allison had congenital brain anomalies resulting in cerebral palsy and were prepared for what that required of us. Our family thrived for years with the help of innovative educators, allowing Allison to be fully included at her neighborhood schools while developing lasting friendships, as well as with the support of our loving extended family. We relied extensively on excellent medical teams at the University of Michigan and health insurance, including Michigan Medicaid, as well as a special Medicaid program for children with disabilities up to age 21. Over the years, Allison became increasingly medically fragile as she developed more conditions, including orthopedic problems, seizures, and restrictive lung disease. She has endured more than 4 dozen surgeries and procedures. When she was in 7th grade, a neurosurgery left her with meningitis that caused a stroke, resulting in additional disabilities and medical issues, including a life-threatening metabolic condition. Allison was 15 when she got a severe case of influenza, causing permanent lung damage. She was left requiring oxygen at all times, non-invasive ventilation when sleeping or sick, and was no longer able to attend school. 2 bouts of COVID greatly diminished her stamina, caused even more lung damage, and stole her ability to eat and swallow safely, leaving her completely dependent on a feeding tube. She now needs to be on a ventilator for 15 or more hours each day. Allison requires 24-hour care, including over 60 doses of medications and more than 30 breathing and other respiratory treatments and cares every day, as well as constant monitoring, especially of her respiratory status. She is now only strong enough to be able to sit up in her wheelchair for about 2 hours twice each day. Allison is immunocompromised, so she stays home except to go out for walks during warm weather. Allison receives palliative care as we focus on reducing medical interventions, being certain everything we do emphasizes her quality of life. Despite all of this, Allison is one of the most joyful people you could ever meet. She continues to show us every day how brave, strong, and resilient she is. As Allison's need increased and she became technologically dependent, she was granted a Michigan Medicaid Children's Special Health Care waiver. From ages 16 to 21, this waiver provided in-home nursing care for her at night, as well as during some daytime hours. Oh, for Pete's sake. Excuse me while I try to turn my page. Families of children with disabilities often refer to aging out of pediatric services and into adult world as falling off the cliff. While this was true for us, we ended up being one of the lucky families. After a difficult, lengthy, involved process, Allison was granted a Michigan Medicaid My Choice waiver. She qualified under the section of this waiver that provides nursing services to individuals with physical disabilities ages 18 to 64 years who meet a nursing facility level of care. So what is a Medicaid waiver? In the past, many care services were only paid for by Medicaid when they were provided in a nursing home. A waiver waives that requirement, allowing services to be paid for in an individual's home. This saves tax dollars. It often works very well for families who are willing and able to care for their loved one, but just need some help. To be eligible for a waiver, individuals are evaluated and must demonstrate the need for a level of care that meets the state's requirements for services in an institutional setting. Since waivers are discretionary, each state chooses if they will grant waivers and determines the maximum number of waivers available. States must show that each waiver does not cost more than the same service in a healthcare facility, provides reasonable and adequate standards to protect a person's health and welfare, and uses an individualized, person-centered plan of care. When Allison was evaluated for the waiver, she was determined to be eligible for 98 hours of private duty nursing each week. This allowed us to have her cared for by a trained nurse most nights and for several hours most days. We were able to do well for many years with an average of about half of Allison's care being done by some amazing home care nurses. We are doing relatively okay now, but are struggling a bit as we do not have any help at night. COVID made it more difficult for our agency to fill all the allotted hours. As we all age and Allison's needs continue to increase, the help allowed us by the waiver has become more and more essential to our family's well-being. Not wanting to consider it, but feeling we had to be realistic as we approached 70, we once asked our waiver case manager what our options might be if we could no longer physically care for Allison and we lost the waiver. We were told that there were no facilities considered appropriate for someone with Allison's needs that would likely be willing to care for her. It's a hard thing to realize that the best long-term plan you can come up with is to outlive your child. So how does having a Medicaid waiver help us as a family? The waiver supports us with trained nurses likely to catch problems early, keeping Allison healthier and less likely to need acute medical services. Having nurses allows Allison, now in her 30s, to interact with people other than her parents. Even without current help at night, the waiver allows us time to sleep, to leave the house, to run errands, to keep our household functioning, to volunteer with Girl Scouts, to go for a walk, see a friend, go bird watching, and even attend a political event. It helps us to continue to be able to care for Allison as we age with our own health challenges. We know we can no longer provide the care Allison now receives completely by ourselves for any length of time. Having the waiver keeps us hopeful because we know we have hours available to get help at night if we can only find the nurses. Having in-home care supports our family values as we focus on quality of life. What would it mean to Allison and to us if any of Allison's Medicaid was cut? Despite Allison being on my very good Blue Cross Medicare Advantage plan, we rely extensively on Medicaid to cover the many things that plan doesn't. Allison's health and life depend on continued access to her ventilator, oxygen concentrator, pulse ox monitor, nebulizer machine for breathing treatments, cough assist device, airway clearance vest, suction machine, and feeding pump, as well as all the supplies needed for those machines. Medicaid also helps with some of Allison's extensive medication costs. Without waiver support, Allison's quality of care would be severely compromised. We know we would be unable to be on 24/7 and maintain the level of excellent care she now receives. It would be extremely isolating for our family. Caring for Allison day and night would make it nearly impossible to leave our home for more than quick errands. Without the support of the waiver, our mental and physical health would both be at extreme risk. If we absolutely could not manage caring for Allison without the help of the waiver, the only possibility would be a specialized ventilator unit in a nursing home, if we could find one that would admit her and if Medicaid would pay for it. The amount of direct care she would receive in a nursing home would not be near what she needs, as staff ratios do not support one-to-one 24/7 care. At that point, we really would have no options, as we do not believe Allison could survive in a care facility. So I just want to say that continuing Medicaid support is not only essential for our family and Allison, but also crucial for millions of individuals and families across the country, some of whom are unable to stand up and speak up. It's up to us to speak up for them. Thank you so much, Karen.